Today we're going to be discussing person-centered care. But first, what is person-centered care? Since its conceptualization in 1969, the idea of person-centered care has greatly evolved and has become an essential aspect of healthcare. Essentially, it can be defined as understanding the patient as a unique human being and encompasses all aspects of patient care and treatment, as is outlined through McCormick and McCan's framework for person-centered practice. Person-centered care emphasizes the value of building relationships between the healthcare team, their patients, and their loved ones by promoting decision-making, meaningful living, pleasurable living, and personhood. By doing this, healthcare staff are able to co-design and deliver personalized care that is culturally safe and provides best possible outcomes and satisfaction for all parties involved.
It is very significant to practice person-centered services in workplaces because it brings not only positive beneficial outcomes to patients, families, and health professionals, but also provides satisfying outcomes with developed trust. With detailed care, fulfilling patients' needs and preferences can promote healing processes. Moreover, by improving individual health outcomes, expenditures can be diminished, and the financial margins can be increased. On one hand, by transforming professional terms into easy understanding vocabularies, families and nurses can build up a positive relationship in order to avoid confusion, conflicts, and informal decisions. On the other hand, for other health professionals, the enhancement of reputation among healthcare consumers will largely influence the satisfaction rate.
In McCormick and McCan's definition of knowing self is about self-awareness and engagement with others. When providing treatment for patients, medical professionals have a responsibility to be aware of their own biases. We need to be clear about where we stand on the subject and advocate for what we believe to be right. This helps professionals to assess the potential impact of their values and perspectives on the decisions they make on behalf of patients. It is important not to project your own beliefs onto the patient because they may have different beliefs and this would appear as intolerance. Before one can provide adequate medical attention to a patient, it is vital to have a strong grasp of one's set of basic values and beliefs, as well as a strong sense of identity. A lack of self-awareness and empathy among nurses would impair the therapeutic relationship, as the patient's dignity during treatment would be undermined. Furthermore, because self-awareness evolves around self-discovery, it fosters therapeutic conversation between nurses and patients, which is at the heart of quality of care. Another way in which nurses can contribute to the delivery of person-centered care is by demonstrating professional competence by adopting a growth mindset. According to McCormick and McCan's person-centered care framework, professionally competence is about individuals' knowledge, abilities, skills, and attitudes that enable them to effectively negotiate diverse care options and provide holistic care.
Essentially, competence is a combination of the training, skills, experience, and knowledge that a nurse has and their ability to apply them to safely perform a task. Needless to say, a patient's life can be dependent on a nurse, so being professionally competent is essential because it ensures a better care outcome for the patient and their family. Similarly, nurses also contribute to a person-centered outcome by providing holistic care. So what is holistic care, one may ask? The term holistic care refers to a care process that takes into consideration the whole person. According to McCormick and others, holistic care is an approach to healthcare that addresses the patient's physical, emotional, social, psychological, and spiritual needs. This sort of care is comprehensive. In other words, rather than treating just the patient's illness, holistic care aims to enhance the general well-being of the patient. For example, while providing care to an accident victim, holistic care takes into consideration how the trauma may impact their psychosocial and spiritual well-being and direct care adequately to facilitate healing. So why is this important? Holistic care is very important and beneficial to the patient because it sheds more light on these barriers that may impact the patient's health outcome and empowers the care providers to bring their humanity to care.
McCormack and McCants identified 5 attributes of healthcare which are prerequisites to person-centered care. One of these is interpersonal skills, which can be defined as having respectful, verbal, and non-verbal communication across all levels to find mutual solutions. Competency in communication also involves active listening, empathy, considering barriers and making allowances, collaboration, and demonstrating an awareness of factors which may affect communication, such as unequal power relations. The prerequisite of interpersonal skills is essential to the ANZAC domain of providing safe, appropriate, and responsive quality nursing practice. This domain consists of 3 standards of practice, which are delivers safe and effective care within their scope of practice to meet outcomes, provides effective supervision and delegates safely within their role and scope of practice, and recognizes and responds to practice that may be below expected organizational, legal, or regulatory standards. According to McCormack and McCants framework, operationalizing of interpersonal skills for safe, appropriate, and responsive nursing involves practices such as authentic engagement and working with the patient's beliefs and values. Notably, interpersonal skills for this ANZAC domain may be compromised by a range of factors. Example, organizational culture. So nurses need to learn to manage conflict. Patient-centered care involves a partnership and shared decision-making between patients and healthcare professionals. To form this type of partnership depends on nurses having high levels of verbal and non-verbal communication skills so that they are responsive to and respectful of a patient's beliefs, values, and preferences, even if they differ from their own. Placing the patient at the center of care involves practices such as educating patients about their health care and providing patients with knowledge to empower them to make decisions about their care. These types of practices are connected to providing safe, appropriate, and responsive nursing, as research shows that there can be a positive relationship between these types of person-centered care practices and patient safety in areas such as falls, infections, and medications use and misuse.
A crucial element to patient safety and person-centered care is speaking up for safety. What does this mean in the context of healthcare? Speaking up for safety is an essential practice where healthcare professionals collectively and individually prioritize the safety of the patient and patients in the healthcare setting, thus promoting a safety culture. Interpersonal skills is crucial for nurses to foster a safety culture as they most commonly work together in teams, and the quality of their relationships and how they communicate to one another has been demonstrated in studies to affect patient safety. For nursing students in their first year on clinical placement, being assertive and speaking up is important, as they are more likely than any other health professional to be asked to perform tasks that are outside their scope of practice. Not speaking up or failing to act is shown to cause emotional and moral distress upon students and complicate their personal development and education. This is also paramount to the 6th domain of ANZAC. By addressing patient safety issues, as well as not obliging requests that are outside the scope of practice, nursing students would be satisfying their obligation to provide safe, appropriate, and responsive quality nursing practice for their patients. More specifically, accepts and delegates care according to own or other scope of practice, identifies and responds to incidents of unsafe or unprofessional practice, clarifies care delivery which may appear inappropriate. This is corroborated by McCants and McCormack's person-centered care through interpersonal skills, effective staff relationships, appropriate skill mix, engaging authentically, all leading to a good care experience. Here is a list of references used in this video. Our group contribution and declaration.